Ayan. Sunduin natin si Papa. Hinahanap natin si Papa. Hinahanap natin si Papa. Room 302. Room 302. Ay. Hindi ko alam kung nasaan tayo. Tayo ay nawawala. Hello. Picking up. Mr. Paxson.
Oh, do you know the room number?
302. Which direction?
Oh, 302. Yes.
Thank you.
Come on in.
Salvador.
Oh. So, you're gonna stick around for the teaching, yeah, for his IV antibiotics, and then we'll discharge today.
Copy.
Yeah. Okay. Good.
Binigyan uli ako ng peak line. They have given me a peak line again.
Okay. And then you finish this when you can.
Okay.
Okay. Thank you.
Thank you.
Hi. Oh, and she's here already. Perfect timing. You just got here. Thank you. Thank you.
Hindi ka naka-uniform eh.
Nagpalit ako pa.
Hi.
Hello.
Okay. Hello.
Hello, ma'am.
I'm Janelle. Nice to meet
Oh,
you.
Janelle. Yes, you're Janelle.
Yep, from Option Care.
My son will,
Oh, your son's gonna learn too.
yes, he's
Okay.
going to learn how
Okay.
to install the,
Perfect.
it's not the peak line.
Yeah,
it's the
it's a midline this time.
midline,
Yeah,
yes.
but pretty much the same thing.
Yeah.
I'm glad I came. I was like worried by the time I came they wouldn't be done yet putting in your line. Okay.
Just a few minutes before you hang up, there
Yeah.
were two ladies who came over.
Oh, that's good. You didn't get a time
I
to
was
rest
surprised
then, yeah.
when they arrived. I was thinking that it was you.
Yeah. Okay. So you're kind of familiar with it already, yeah? You said you are, but then, what was your name again? Sorry.
Salvador. Shamir.
Shamir.
Oh, okay.
This is a junior of mine.
Okay, first thing, we're gonna watch a video, okay? I'm gonna put it over there and then both of you guys can watch it, okay? I don't know which way is best for me to put. You gonna come on the other side and then I'll just put it over here?
You should be here.
Okay.
The three of us. The two of us.
Yeah. Okay.
Let's make sure.
Just make it louder. Okay, so this is what you're gonna do this time, okay?
Your healthcare provider has ordered a medication that will be administered using an elastomeric device. This instructional video will help you administer your medication effectively, comfortably, and safely. To get started, remove your medication from the refrigerator at the time specified on your medication label. Never speed the warming process by heating or microwaving the medication. Select a clean work area. Once established, clean your hands thoroughly using antibacterial soap and warm water. If no soap and water is available, use an alcohol-based hand sanitizer. Follow by drying your hands with a clean towel. Gather your supplies and prepare your sash mat as instructed. medication ball, flush syringes, alcohol wipes, and if
Those were
necessary,
the
sharps
four
container
syringes
and
that
or
I-
trash container.
that had been
Yeah.
infused on me the first
Yeah.
time.
Check
Yeah.
the label and verify. Correct name of patient and medication. Volume, amount of medication. Discard date of medication. Amount of time needed to remove medication from refrigerator to warm to room temperature. Prior to using syringes, push firmly on the thumb press with the tip
Kaya
cap
ano,
still
hindi
on,
pake.
just until you feel the plunger move. Expel air and excess solution by twisting off the tip cap and pushing the plunger forward. Push out extra solution to the amount instructed by your nurse. Finally, replace the syringe cap, being careful not to touch the tip of the syringe with your hand. If you touch it, you will need to start over with a clean syringe. Set aside the syringes until you are ready to use it. Repeat this step for all flush syringes needed for dose.
Short.
Yeah, it's a little bit shorter. So I'm gonna give you the thing to make it longer so it's
Okay.
easier, okay?
On your IV catheter with an alcohol wipe
remove,
for at
you
least
know.
15
Yeah, yeah.
seconds and allow to air dry. Remove the protective cap from the saline flush syringe. Attach the saline flush syringe to the needleless connector using a push and clockwise twisting motion until secured together. Open the clamp on your IV catheter and or IV extension set if indicated. Flush your IV catheter using a push-pause method. Do not attempt to flush if resistance is met. Double check that all clamps are open, then call your nurse or pharmacist. Lastly, remove and discard the saline flush syringe in a trash container. You are now prepared to administer your medication. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove the protective cap from the medication tubing. Attach the medication tubing firmly to the needleless connector on your IV catheter. Open the clamp on the medication tubing. The medication will run over the specified number of minutes as instructed by your nurse. If the medication ball does not deflate as expected, double check to make sure all clamps are open. If the clamps are open and the ball is not deflating, call your nurse or pharmacist for assistance. When the medication ball is completely empty and deflated, close the clamp on your medication tubing. Remove the medication ball and discard as instructed. You are now ready to flush your IV line with saline again. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove the protective cap from the saline flush syringe. Attach the saline flush syringe to the needleless connector on your IV catheter. Flush your IV catheter using a push-pause method. Close the clamp on your IV catheter and or extension set unless you have been instructed to flush with heparin. Lastly, remove and discard the saline flush syringe in a trash container. This will conclude your IV medication administration unless heparin has been ordered. If ordered, you will need to flush your IV line with heparin.
Heparin flush.
Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove the protective cap from the heparin flush syringe. Attach the heparin flush syringe to the needleless connector on your
That's a
IV
different
catheter.
kind.
Flush
That
your
one
IV
is, yeah, that one is the heparin. The other two is the saline.
Close the
Okay.
clamp on your IV
Now,
catheter and or
That's
extension set if
that's
indicated.
what I'm going to use.
Lastly,
Yeah, you're going to use
remove
the
and
heparin
discard
too.
the heparin flush syringe
Oh,
in a trash
so there are two of it.
Thus concluding
Yeah,
your
the
IV
heparin is
medication
used to just make sure the line doesn't get
Here is a
clogged.
SASH procedure
Okay.
summary to ensure you are administering your IV medication effectively.
Which one would be
Flush
the
your
first,
IV
the
with
heparin or the
Administer
ball?
your medication over the
It's
number
gonna
of
be
specified minutes.
the heparin will be last.
Flush again
Okay.
with saline.
So it'll be the saline,
Flush with
then the
heparin.
ball, then another saline, and then the heparin.
Oh, so there will be four of them.
Yeah, same like the last time, except
Oh.
instead of the middle syringe, you're gonna have the ball inside.
Okay, now I
Okay.
understand. I was
Contact our
thinking that
highly
it's
trained
only
specialty
the
nurses or
ball.
pharmacists.
No, yeah, you still have to do the other parts. Okay.
Okay.
And will answer any questions.
All right. Okay, so I'll show you, and then you can do after. Okay. So you remember this one? You had this
Yes,
the last time,
yes, I
yeah?
remember that.
Okay. So, is it okay if I move your papers on the side
Yes,
for now?
please.
Okay.
All of this stuff.
I'm gonna just put it over here.
So with this phone.
Yeah, I'll move the phone too.
Thank
Oh,
you.
wait. Oh, sorry. Okay.
So could I sit over here?
Yeah, you can sit. You want to go up?
Okay.
Pull your thing up.
No, I'm going to sit
You're gonna sit up like this better?
on the side of the bed,
Oh, okay.
so it will be clear for me. That's it. My phone down now.
Okay. Okay, so just to remind you. Okay, just to remind you, yeah? Before you do anything, you're gonna wanna make sure, wash your hands, yeah? Wash your hands, soap and water,
Yeah.
and then dry with a paper towel.
Okay.
And then you're gonna clean the area, okay? So clean with Lysol, Clorox wipes, yeah?
Okay.
The surface that you're gonna work with, and then this mat also, okay? And then we're gonna get everything ready.
Ito.
I can also send you the
The video?
video.
Okay.
Yeah, so you
Okay.
guys can watch again.
Okay.
So then we're gonna set up our mat, yeah? So we have the saline, and then the medicine,
This is the saline.
yep, and then the medicine, and then another saline, and then the heparin, yeah?
Also,
then-
this is the antibiotic.
Yeah, so this is the antibiotic, yeah?
Yeah. Oh, there's a similarity.
Yeah,
The
it's
only
very
thing is-
similar. This is the
one.
only thing that's different.
Yeah.
Yeah? So remember all of these will be single use. Yeah, it's gonna come like this
Yeah.
in the plastic, yeah?
Okay.
Okay. So when you get it, all of these things are gonna have air inside, yeah? You remember?
Yes, yes.
So you
we
got
have to remove the
Yeah,
air.
correct. So see,
We have to remove the bubble.
yeah, on here there's like this air bubble on the top. So you
Okay.
gotta remove the air from all of the syringes. That's
Okay.
the first thing you're gonna do.
Yes, understood.
Okay? Because you don't want the air to go into dad's line.
Okay.
Alright. And then after that, we're gonna go ahead, so make pretend like this is inside your arm, yeah? So
Okay.
they're gonna attach this before you leave, so you'll have a lot more space, yeah?
Yes.
And then
there's-
see this blue cap,
Mhm.
ours is gonna be green. That one I think they'll probably take out before
Yes.
he goes
This
home.
another one.
Okay.
This is IV.
Yeah, so this one is gonna come out like this, okay? So let's make pretend this is the end of your line.
Okay.
So first thing we're gonna do, oh, I forgot my alcohol swabs. Okay.
I could start it this evening.
No, you already had today, so you're gonna start tomorrow.
Okay.
Yeah.
So tomorrow, not this time.
I think they told me that you had it a little bit before 2 o'clock, maybe one
Oh, okay,
something I
2
think, or
o'clock,
two
okay.
something you had.
Okay.
I can double check with the nurse though. So yeah. Okay. So yeah, everything's all set up with our alcohol
With
swab.
alcohol. This is an alcohol.
Yeah, and then we removed all the air, yeah, from all the syringes.
Okay.
So we're gonna clean this green cap. Take off and then throw it away, okay?
Okay.
Only single use. Every time you gotta replace with
Okay.
a new cap. Okay, and then we're gonna clean 15 seconds.
15 seconds.
Yep, 15 seconds. And then let it dry. And then we're gonna open this up, throw the cap away. And then we're gonna attach it. Just gonna push
Then
and
turn
then
it.
turn. Yep. And then we gotta make sure that the clamp is open.
Okay.
So we have to open this one. And then we also have to make sure
This
to
is
open the top one
Yes.
too. Y'all see how
Yes,
it's closed
this,
now?
This is really hard to open.
Yeah, but somebody, it's the same like this one, I think. You just
Yes.
push it. Push the top.
Oh,
Yeah.
okay. I
And
just
then to
open it.
clamp it, you just push it down. Okay?
Okay, now.
Yeah, so you gotta make sure this one open and this one. Okay?
Okay.
And then after it's open, you're just gonna push pause like in the
Okay.
video. Push pause, push pause, push pause, push pause. Oh, I forgot to open it. Push pause, push pause until it's all done. Okay?
Okay.
And then we can throw this away into the
Because
regular
it will be
rubbish.
pushed. instantly, oh, it's so painful.
What was that?
It would be so very sore if
Oh, right,
because-
right. You don't want to push it all at once.
Yes,
Yeah, you're going to
yes,
push
it should
little
be
by little.
slowly.
Yeah,
Yeah.
yeah, little by little. And then after that, this is going to go into the regular rubbish, okay?
Okay.
The syringe. Okay, and then we're going to clean again. So anytime something touches the line, you got to clean your arm, yeah? 15
Okay.
seconds. And then throw away. So this one, the end is going to look like this. Has like these little flat wings at the end.
So this would be the second.
Yeah, so this is
Okay.
the medicine.
Okay.
So you're just going to twist it to come off.
Okay.
Throw the cap away. And then the same thing. Push. And then twist.
So throughout the medication, this would be
So this medication, when they deliver it to you tomorrow, is gonna be cold, yeah?
oh,
You need to keep these inside the refrigerator.
okay.
And then you're gonna remove it about 1 hour
1 hour
before you're
the-
gonna administer.
Okay.
Okay?
So if I'm going to
So if you're gonna
Start at
administer,
2.
yeah, then you gotta take out by 1.
1, okay.
But they said tomorrow they're gonna deliver it to your house by 12 o'clock, okay?
Okay.
And then the last thing we have to do to make sure the medicine's going, this one has its own clamp. So all
Okay.
you have to do, open the clamp. And then that's it.
There is a clamp.
Yeah, so this one is
And
the clamp that's on
There's
your arm.
there are 2 clamps.
And then this is the clamp for the medicine.
Okay.
So you're just gonna open it up, yeah?
Okay.
And then the medication will just run by itself. So
oh.
Okay.
So even if it's in a low,
even if it's lower, higher, whatever, it doesn't
it's
matter.
going enter my body.
Correct, yeah.
Okay. For
So
how
the-
long?
It's gonna be over 30 minutes.
Oh, 30. Oh,
Yeah,
that's
so
too
I would
long.
say after maybe 10 minutes or so, look at the ball and make sure it's getting smaller, yeah? Just to make sure
Oh,
that you
so it's
didn't.
going to be smaller.
Yeah, so when it starts, it's gonna be really big. But then by the time it's done, it's gonna look like this.
Oh.
Like all the
I
medicine.
was
will be
thinking that it's bottle.
No, it's like stretchy. So then
Okay.
it pretty much is like a balloon, and then it just slowly deflates, and then all the medication goes inside. Okay.
Okay.
So after the 30 minutes is up, then you're gonna disconnect it. Disconnect. Sorry, mine's just gonna leak, so I'm gonna put this back on. And then
Then
even
throw it
this too,
away.
yeah, throw away, regular rubbish. And then we're gonna clean again. Alcohol. 15 seconds. And then we'll do saline again to just make sure that all the medication goes in.
Okay.
Same thing. Push and twist. And then push pause, yeah?
Yes. Push,
pause.
stop, push, stop,
Yeah.
push, stop, push, stop, push, stop. That's what my wife is doing.
Yeah.
Push, stop,
Yeah.
push, stop.
Then throw away. And then we're gonna do clean again. 15 seconds with the alcohol. And then the last one is the heparin. This
Heparin.
one-
That is the heparin.
Yep, so this
From
one.
5 to 2.
Correct. You knew what I was gonna
yeah.
say. Yeah, so this one you don't need to do the whole thing. So you're gonna go from the 5, and then you're gonna stop when the top of the black thing hits the 2. Okay. And then after that, before you unhook it, you're gonna clamp. Yeah, so make sure you clamp this line, and then clamp your line up there.
Okay.
And then remove, and then even if there's medication in here, just throw
Throw
away.
it away.
Yeah.
Yeah.
Okay? And then you're gonna clean again with alcohol before you put one more cap. Put your new cap on top, yeah?
Yeah. That would be attached here.
Yeah, it's gonna be attached here. This is gonna be attached like this.
Okay.
And then you just gotta put a new cap at the end.
Okay.
Okay? Alright?
Are you going to attach it now?
No, the nurse will attach it before
Okay.
you leave. Okay?
Okay. So that would be no. Oh,
And
what
the
would be
point
the
one.
first?
This one is gonna be attached in here. So you,
Ah, okay. Now I
yeah. So
understand.
this will be in here.
Okay.
Okay, like this.
Okay.
Okay? Alright,
Now,
now your turn. You ready?
go ahead.
Okay, my
Oh,
turn.
your turn?
I need to wash my hands.
Okay. Or you
Oh,
can,
no,
you
no.
can just make pretend like you're going
Okay,
to wash your hands. Let me just get everything over here and let me get you some alcohol swabs. Good, you can go home today, yeah? You don't have to wait
Yes.
till tomorrow.
Yes, I've been here for the past 5 days.
Okay, that's good.
Sunday when I went to the operating room for
Mhm.
surgery of my gallbladder.
Mm.
And this is my 3rd day.
Okay,
Okay.
ready for you.
Ito yung pinakakulit na, no?
Oo.
Last one. This
Yeah,
one is
so-
attached there.
Yeah, this one is attached. So this, I'll just hold on to this so then we don't get confused.
So right now, I will be cleaning it. Take this one off, throw away, and then clean.
Yeah.
Mm-hmm.
And then put this one, take it off, clean.
So those things you don't need to clean.
Okay.
You never have to clean these because these are all single use.
Okay.
Just gotta always clean that.
So this one clean for 15 seconds.
Yeah, but did we forget something?
Oh, you forget something. You have to remove the
The air.
air.
Yeah, so that's why it's usually
Yeah.
better to remove the air from all of them in the
Yeah.
beginning so you don't have to worry. I mean, there's only air
Okay.
inside, so you're not
So
gonna be able
right
to see.
now, I mean,
So typically, like, there's just like a small
Imaginary.
amount of air.
how
You
much?
can't see.
How much do they?
Usually you just
Sure.
push it up until at least a little bit. You see a little bit of the drops come out.
Maybe like 2 drops.
Yeah, yeah,
Okay.
yeah.
After that,
Just
2
say
drops,
remove the air.
yeah.
That's it. Just
Okay.
say remove the air. That's it.
If a little bit more than a couple drops come out, it's
Yeah.
not a big deal.
Okay, and then put.
Turn it around.
Okay.
Yep.
And then push stop.
Push it stop.
Is it letting you push?
Then open the line
Yep.
there, and then open the line there.
Correct. Yep. So both of the clamps have to be open.
There should be 2 clamps.
Yep. There we go. And then now you can do
Push,
push stop.
stop.
Yep.
Push, stop. Push, stop. Push, stop. Push, stop. Push. I'm at the end of the line. I now have to feel it.
Okay. And then close.
No, you can leave it open because you're gonna keep using it. Yep.
Okay. Then throw regular rubbish.
Yep. Throw away.
And then clean again.
Yep. Clean again.
15 seconds.
Yep. 15 seconds. Thank you.
For this one, 1 hour out from the refrigerator.
Mhm.
Yeah. See, I forgot it.
That's okay.
So this one open.
Yep.
Throw.
Yep. So you just twist it off.
Is that going to be thrown away?
Yes.
Yes.
So you'll just get a bag with like all the balls
A
inside.
different one.
Yeah, it looks a little bit different.
Okay.
Yeah, it's a different.
And then it's the same
Now
thing.
this one, no need to take out any air.
Yeah, no need to take out there.
And then, oh, open.
So just make sure that one is open.
Open and let it stay there.
And
No need to shake.
No need to do
No
nothing.
need to do nothing. Okay.
30 minutes.
Right.
More than 30
Or
minutes.
until it's shrink.
Until
Yeah, and so it's gonna 30 minutes. Sorry, there's water in here. That's why it's coming out. So I just clamped it.
Okay. And
But yeah, so after the
that,
30 minutes,
after
then it'll be all
30
done.
Throw away again.
Mm-hmm.
And then it's gone. Another clean.
Yep.
15 seconds. Put out the air on. Open first. Throw. Put out the air.
Mm-hmm.
Air out. So it's clean already.
Yep.
Oh, that one open, that one open.
Yep.
Push stop again.
Yep.
Push stop,
It's okay. It's water.
Okay.
Because it was from the bowl.
push stop, push stop. stop, push stop, push stop, push stop again, and again, and so throw again, and then clean again, 15 seconds. How about this one? Does this one
That
have
one
any
is-
air?
That one also has air, yeah.
Has air. Throw the cap, put out the air, and then wherever it is.
Yeah, however
So,
much.
usually from 5 to 2.
Correct.
Yeah.
Yeah.
Okay. So
Got it.
clean.
You got it. That's important.
Yeah. Make sure here. You don't want to put the air inside the line. And then up, everything's open.
Until the top
5
of
to
the
2.
block inside goes into the line. Number
Yep.
2.
Yep. And then now what?
And then now that's it.
Clamp first before you
Oh,
take it off. Yeah.
okay.
Just to make sure nothing comes out.
Goes back.
Yeah.
Okay.
Yep. So just clamp, and then you can remove,
Okay. Throw.
Cover.
Then
Yeah.
another cover.
clean, and then cover.
And another cover.
And then that's it.
That's it.
This
Yeah.
thing, the extension, no need to remove.
No, so this extension will be on here, and you'll just leave it like that.
Okay.
Every week, somebody from Option Care will call you to schedule the nursing visit. Because the nurse is gonna come, and then they're gonna change your dressing. So see how right now the white, you have that white little sticky thing around?
Yes, yeah.
So it should look like this, yeah? So your skin is nice and smooth, not red, not
Okay.
swollen, no irritation, yeah? If for some reason, you have any irritation or anything leaking or pussy or anything, make
Okay.
sure you let us know right away.
I'll let you know.
Okay?
I'll let you know. So that would not be the one that would be installed over here.
This is the one that's good. So even this, they'll change this every week too. The nurse will give you a new one.
It should be sterilized before it could be placed over here.
Yeah. It comes in this like pre-packed. This is just my practice one.
Ah, okay,
Yeah.
okay.
Okay?
Yeah.
Okay.
All right. Let's see what else I didn't go over yet. Let me see. Yep. So the nurse will come every 7 days to do your dressing change, and then they'll also draw your labs.
Yes,
Yeah, so they'll take your blood for
testing.
Yep, for Dr. Chung. Yep. And then each of these balls is gonna have a label. It's gonna have your name, the name of the medicine, which is this ertapenem, and then it'll tell you to take it out of the refrigerator, and then it'll
1
tell
hour
you
before.
yeah, and then it'll tell you to do one of these every 24 hours, and then that's gonna take like 30 minutes. Okay? So just make sure, and then also we only gonna call to arrange a delivery every week. So make sure that you're using the medication that is the oldest, yeah? So you don't want to use from the new shipment until you finish the old shipment.
First in, first out.
Yeah, because the medicine is only good for a certain amount of time, so you always want to make sure you use the oldest one first.
Okay.
Okay?
Just leave it alone, whatever level it is, and it would
Yeah,
go
so
in my system.
correct, yeah. And then you can just put it in your pocket or whatever, and then
After 30.
yeah,
more
so
than
you don't
30
have to
minutes.
stay still for 30 minutes. You can
Oh,
go
okay.
around. It's okay.
Okay.
Okay? And then, yep, just don't forget, always wash your hands. And then, if anything, you probably already know, but in case, if anything touches this, like you drop this on the table before you connect it to him, throw away.
Don't do it.
Yeah,
Just
don't use
throw
it,
away.
yeah.
Okay.
And then, let me see what else. Oh yeah, even the line. If for some reason you notice your line over here looks longer than it was before,
Okay.
then make sure you also let us know, because you don't want the line to move, yeah? Because you don't want it to be in the wrong place inside of you.
Okay.
And then, so tomorrow when they deliver the medicine to you, you probably know they're going to give you one cooler, yeah, with all the medicine.
Yes, with the
And then there'll
cooler.
be a separate box with all the supplies.
Okay.
So it'll be all
This
of
kind
this,
of
yep,
supplies.
all of your flushes.
And this will be in the
alcohol.
cooler.
Yeah, and then this one will be in the cooler. And then there'll also be the big red box, yeah? The one, the sharps container. That-
there's a sharp container.
Yeah, so they'll send you the sharps container. That'll be for the nurse.
Oh, okay.
So make sure you keep that. Don't throw it away, and then don't throw the box away either, because the box is going to use to send back after you help.
Okay.
And then if for some reason you don't have any emergencies, then of course call 911. But if you have any problems, with your line or administering the medicine, or if you have any questions, then our office number is over here, yeah? The 489-9385.
Okay.
And then if this is the one, if it's during the day, 8:30 to 5, then somebody will answer. If it's after hours, you need to push 9, I believe, to talk to somebody. Or you can call Physicians Exchange and ask for option care. Then somebody will call you back, okay?
Okay. In case of emergency.
Correct. If you have an emergency or if you have any questions.
Okay.
If you're having any issues with your line or anything. And then, let me see.
You're going to take this with me.
Yeah, I'm going to give this to you, and I'm going to put more notes on there so you don't forget. And then just make sure you follow up with Dr. Chung, yeah? You're gonna see him in a couple weeks?
Okay. He's going to make an appointment with me
Okay.
by phone.
Okay, sounds good. And then just make sure, also too, if you notice any signs and symptoms of infection, flu-like symptoms, fever, also let us know.
Okay. Hopefully not.
Yeah, hopefully not, but just in case.
Yeah.
And then you did receive this medicine in the hospital, but just to remind you, you could get upset stomach, nausea, diarrhea, yeah, from the medicine. And then if for some reason you start to get a rash, also make sure you let your doctor know, or us know. All right.
Okay.
Do you have any questions?
No.
You want to try? Or
No.
you're okay?
No, they're going to do it for me.
Okay.
Not me.
You live with him.
No.
I'm gonna relay the same information.
Okay, to your
To
mom.
my, yeah.
Okay. All right. I'm just gonna have you guys sign then, okay?
Okay.
And then I'm gonna finish writing the notes on here.
Where am I going to sign?
So you sign here, and then I'll have your son sign underneath, okay?
What's
And
today?
today's 18.
Kubeta. Basura.
Pwede kang pumunta mag-isa pa.
Oo.
Wala ka pang sinyala.
Meron na dyan. Thank you, anak.
Where do I need to sign? The top here.
Oh yeah. You can just put caregiver on the bottom, and then you can put son. And then you know this. I don't know if somebody wants to take a picture of it. Because you know when you clean it all the time, it might come off all the writing.
Okay.
Just in case you want
Okay.
the notes, okay? But I'm gonna put it in here. And then there's also this instructions as well. It goes over everything.
Okay.
And then to watch the video again, you can just go to the website or scan the QR code, and then the name of the one that you guys have is the Elastomeric, okay? And then I'm gonna make a copy of this, and then I'll come right back, okay?
Okay.
Thank you.
Wait, so it wasn't through IR nutrition?
Sige po, dali po.
Wala pala akong t-shirt. Wala pala akong t-shirt. Tignan mo nga kung ang t-shirt. Bakit dito? Ako nakatali. Mabuti, titibo na. Yung t-shirt ko wala. Tingnan mo nga kung nandito yung t-shirt ko. Okay. Ayun. Ayan, susuot ko yan. Ibaliktad. Yung short pa kayo dyan. Oo.
O, pantalon na lang.
Oo, mas pantalon na lang.
Uncle, in about 5-10 minutes, they're gonna come pick up Uncle.
Okay.
Yeah. So I'll let just take your time, okay?
Okay. Ay.
Hindi sabihin pa, hindi nga talaga kayo mag-drive. Kaya mo, pero mapapagod ka.
Ingat. Hindi sa ngayon iisipin mo, pangatlong araw ko pa lang na operasyon. Anong lakas ko? Wala akong lakas. Kumbaga hindi ako makagulatay. Mahina na ako.
Anong bag pa? Anong bag pa? Hello?
Alin?
Sa labas.
Ay, sa labas ko na ilalagay ito. Hiro mo yung tinayak kong yan. Ay, hindi pwede sa loob ito. Dahil nandun sa loob yung ano eh.
Jacket. Maambon ka eh.
Baka may nalimutan tayo doon. Ayun. Ito yung camera mo.